run. Don't let this happen to you. All right? There are several barriers that keep us from building the trust, that keep us from being able to communicate in the best possible way with our doctors. So let's review some of the barriers and use some tools to get your needs met. So time, what do you guys think about that? Doctors often have very short time allotted for appointments. What do you think about that? Do you feel frustrated by that?
Sometimes.
Okay,
Sometimes.
Okay, does anybody else get frustrated with the time?
I accept it, but knowing that, I try to be specific, or as specific as I can be, because I don't
One
want
or two concerns.
I don't want to be there all afternoon either.
Me
You
neither.
know, so.
Okay, what about the time you might have to wait in a waiting room?
Oh,
Anybody-
I think that
Time?
discouraged me sometimes.
It discourges you?
Yeah.
Some people
I
don't like
haven't had
sitting.
But
that.
I'm learning
You
patience
haven't
though. I'm
had
working
that?
at,
No.
I'm working patience
And you're
over
working
being
on
patient.
patience? Okay.
Yeah.
Okay, all right, or maybe you arrive a little bit late and they say, I'm sorry,
Yeah.
sorry Loretta, I can't see you today because you're a little bit late, right? So healthcare providers have very, very rigid, and maybe we would consider inflexible appointment schedules, but they are written by time, okay?
You know, I don't have that much problem, cause one thing for sure, they tell you to get there 15 to 20 minutes early. I'm always early
Okay.
bird. I get there early and I wait and, you know,
And you're okay with that?
I wait, yeah.
Okay.
But sometimes I have a problem when I'm there early. Sometimes I get there half an hour or 40 minutes early. Just sit there, you know, and make sure I check in if they
Okay.
have to do my weight, or if I have to go into the room and they don't have no rooms, then I have to sit back in the waiting room.
Right.
So that's why I get there early also. Then they tell us to get there early.
Right.
And
So-
then, you know, sometimes you be extended over hours as you there early and been checked in, and ain't no room.
Right.
Then I get a little discouraged, but now I'm working on patient because they're seeing me, I'm not seeing them.
Okay, so thanks for sharing that. So that is true, but sometimes we don't have all the time. You might have to get home to your grandchildren or something like that. Okay, so time is a problem. What about language? There's language barriers. Has anybody experienced that?
Yeah,
I
I've seen
haven't
it.
really over the phone, but if I'm talking to somebody over the phone and I can't understand them, then there's no communication. So I try to kind of exit that relationship
Okay, okay,
and find someone else that I can communicate with.
okay. That's great because you know you're not communicating well.
Sometimes they use words that we don't understand,
Okay,
medical terms.
okay. Do you ask for clarification?
Well, it hasn't happened really to me, but I know it's happened to some people I know.
Yeah.
Right, well, it's
Yeah.
like you did a great job of explaining gestational diabetes. Okay, for many people, what in the heck is gestational diabetes, right? Okay, so that's true, terms, the
Yes,
terms that we
yeah.
use.
Sometimes they, oh well, your medicine's a PRN. People don't know what PRN is, like, huh?
Yes,
As necessary.
Yeah, we know it.
It's a-
Or they say, oh well, we need this blood test stat. I'm like, I know what it means, but there's people that like, what?
yes. Okay, what about language barriers, really different languages?
Oh, that happens too.
Right, so a lot of the big medical centers, we invite residents from all over the world, right? And that's actually a really good expression of a powerful medical center because people want to come and study there. Sorry, I have bad allergies. So, what about language barriers? What do you guys do with language barriers, like real language barriers?
My mom had that problem. She didn't speak English, so I always went with her. Or my sister went with.
So you bring somebody
Yeah,
along.
I mean, they're supposed to get you an interpreter, but you know, sometimes you don't feel comfortable with an
And sometimes
interpreter.
the language line doesn't work very well,
And
right?
that's true too.
Right.
There's different accents, different words.
Different words.
Yes, and for instance, sometimes you get on the phone to be someone that have a language where they don't understand you, and then they say, I really can't understand English, but I hear you, and sometimes I get discouraged, and I say, I can't hear you. You know, I say it in a vocal voice, and I don't mean to do that, but it's the way they be talking to me. But I don't, you know, go out in the words and say no cussing word. I don't do that.
Okay,
But, you know, sometimes you have to holler out so they can understand you, you know, especially if you're on the call line or the pharmacy line or whatever, trying to get something through to refill your medication. And they have a lot of them, you know, especially, you know, with mental health.
so
You know, they have a lot of them on the call line.
So Denise brings up a great point. Communication is
Mhm.
not just with your primary care provider, but it's with the Metro Health line,
Yeah,
the
call
pharmacy,
line,
the call
pharmacy,
line.
yeah.
Okay. Now, what about emotions? You touched on that a little bit. Sometimes we're very frustrated. We might have gotten, maybe the nurse calls your house and says, oh, Dr. So-and-so said you have elevated this, that, or the other thing. And we get frustrated and angry, right? And so it's hard to listen when you're frustrated and angry, right? So these are all barriers, that little bit, pieces and parts we might experience as we're trying to communicate with our healthcare provider. All right, so let's review what the authors of the TTIM approach thought that you might be interested in learning about how to best talk to your healthcare providers. Tom touched on this earlier when he said, you know what, I come in with my one question. So prepare for your doctor's visit by thinking about what concerns or questions you'd like to discuss with your doctor. So think about those 1 or 2 questions that you have for that particular visit, all right? Some people find it helpful to bring a support person with you to the visit. How many of you bring a support person with you to your visit? Yeah.
It depends on why I'm going to the doctor. And if it's something that I'm antsy about, I'll try to have someone with me. Or if it's going to be something that I'm going for the first time, like when they were telling me that I might have that leg amputated, I brought my niece, who has a nursing background, just so she could listen too, because I might have missed some of the conversation, because when he said amputee, I'm stopped already. I can't hear anything else, you know, so.
Right. So Loretta brings a great point. A lot of times we're very anxious when we go to see our primary care provider, and we don't hear as well as we'd like to. In fact, there have been some studies that suggest that, you know, I might, my primary care provider might tell me 5 things, but I might come home and say to my husband, oh, we only talked about 1, because I only remember a certain amount. So sometimes it's helpful to bring a support person when you can, okay? All right. Now, the next tool is make eye contact and say hello. Why did we bring that up? Well, sometimes when we're with our providers, we think that there's a different kind of a relationship there, and we're not as comfortable, all right? So we brought this in as a communication tool just to remind people that it's fine to just make eye contact and say hello. Your provider are people too, all right? Shake hands if this feels comfortable to you. A lot of providers nowadays do not shake hands. And the reason is not to be distant or to be impolite, it's because of hand washing protocol, okay? In fact, some hospitals invite you to remind your provider to always wash their hands. That's right, okay? They invite you to do that. So we talked a little bit about bringing somebody with you, bring your questions, shake hands, make it comfortable. Write down your questions or your concerns down so that you remember them during your doctor's visit. How many of you have tried that before?
I'll write it down.
Great strategy. There's nothing worse than leaving and thinking, oh my gosh, I forgot to ask them about X, Y, or Z. Okay, great strategy. You might want to write down what your doctor tells you in the session, either during the appointment or right after it. How many of you read your after visit summary that your doctor gives you? Oh, I love that.
Study it.
Yes, great. All the information you need is right there. Your information about what you discussed, your next appointments, maybe your weight, your blood pressure is often indicated, what lab tests you need to have, okay? But sometimes you can take notes too, all right, if that helps you to understand things. Your 4th tool is be respectful and expect to be treated with respect. Why do we say that? Because sometimes we don't feel respected when we are with our providers, right? We feel like they're brushing off our questions, they're not listening to us. How many of you feel that makes you feel disrespected? I do. Okay. So, but to understand, we also wanted to make the point that we all get stressed at times, including your provider. They might be having a bad day too, all right? Okay, so it's important not to accuse them. If your doctor is rushed, ask if there's a better time to talk. How many of you communicate using the email system that your hospitals might have? My chart? You use my chart? My chart?
Yes.
Okay, no, you do not?
I do not have it.
Okay, anybody else use my chart? That's a great
I
way
love it.
to communicate with your doctors.
That's really good.
Good, I'm glad that you use that.
Oh, yeah.
It's a way for you to put out your answers. Now, I would suggest, especially if it's a new provider, that you ask, do you communicate using my chart or whatever your hospital system
Oh,
uses?
he does.
Even the way they respond to questions.
Yeah.
I mean, it's usually within 24 hours.
Yeah,
I know
they
they're
do try
busy,
to
it takes
respond
them a long
quickly.
time,
Mhm. Well, some providers don't use it, isn't that interesting? So again, if you don't hear from them, you might wanna ask at your next visit, do you communicate using MyChart, all right? But if your doctor is rushed, ask if there's a better time to talk, or can I communicate by email to you, okay? That's another way to do it. The next tool is, if there are language barriers, ask your doctor to slow down, to repeat it, or you be writing down the information for yourself, all right? If there's a language barrier, all right. Last, bring your calendar or your appointment visit to schedule your next visit, all right? Because oftentimes your provider will say, Loretta, I'd like to see you in 3 months. So you want your calendar booked right there, right? So you know in 3 months if somebody gives you an appointment on Friday and you're not available on Friday, you can tell them that, okay? I would suggest that everybody make your appointments right when you're leaving. That way you have it. You do? How many of you do that?
They usually do it now in the same room.
Yeah.
The nurse does it in the
They
same
do.
room.
Great, that's great. I love that you're saying that, because that's really the goal at our hospital system,
Yeah,
but
that's,
it
it's
might,
Metro, yeah.
might not be the goal of a lot of other hospital
Yeah.
systems, okay? So what do you guys think about those tips? Are there any other tips that you would consider about communicating with your healthcare provider, or things that you have done that worked for you?
I would say one, don't be afraid of the answer.
Don't be
For
afraid
2
of
years,
the
I thought I was
answer.
developing dementia, and I never mentioned it because I didn't want the answer.
Tom, that's
Yeah.
powerful.
Then when I did, it was so simple. It was a quick test and 1 pill a day, methylphenidate. It was depressive pseudodementia was the diagnosis. And I've been perfect ever since then. I've suffered for 2 years for fear of the answer to the question I was afraid of asking.
Okay, that is very powerful. I suffered for 2 years because I was afraid of the answer. I like that. That's a great tip, right? So, right, Timers, you want to ask the question and not be afraid of the answer. Thanks. A lot of people with diabetes are afraid of, well, what's a chronic health condition I'm going to experience? Am I going to experience limbs or eyes, pseudodementia, all those sorts of things. So I like that. Thanks for sharing that. All right, now for your homework today, for next week, questions or concerns to discuss with your providers. We're asking you to write down your questions or concerns, and then out of all your concerns, pick 1 or 2 that you're going to discuss at your next visit. So you have that paperwork, and I'm also going to ask if you would bring some food labels to the next class so we can learn about how to read food labels. The last thing we're going to do today are 2 things. For your questions for your provider, I want to ask you, what are some of the concerns that you normally have when you go to your provider? What are some of the things you normally, we're just going to brainstorm, what are some of the things you want to ask your provider about? Because I have a list in front of me, but I want to know what you guys think, and I'll fill in the blanks.
Is A1C lower?
How's my blood work? Beautiful. What's another one?
Is my diabetes in good control?
Okay. What about medication questions?
Medication.
Medication, okay. And we already talked about exam results. What are some other options for therapy? I've heard about, all the TV is full of
This
commercials.
is a TV commercial for
That's
this or that. Yeah.
That's right. Could I be considered for that, right?
Yeah.
Or drug trials, right?
Exercise.
Exercise, that's on my list.
Yes.
Okay. What are some other things you might ask you? Could I be referred to a nutritionist
Yes.
for meal planning?
Yes.
Okay. Immunizations, flu shots. I
Yes.
hope everybody's getting their flu
Yes.
shots. Okay.
No.
Shingles.
We'll be talking after class. Okay.
I have a reason.
I'm just kidding.
Doesn't matter what kid is. I mean, the kids get it as long as they get them. Okay.
That's right. And the shingles, that's right, the shingles vaccine.
Oh, the
If you can
shingles
get
is
that,
something really bad. I've
right,
heard.
it's hard to get, right?
Yeah,
Okay.
my best friend had it, and it's painful.
The vaccine is hard to get.
No, the
It's
vaccine.
very hard to
She
get.
she had it. I mean, she
I
had the
haven't had my
shingles.
single shot yet.
It's hard to
I
get,
haven't had
I
it.
turned 60 this year, so I gotta get mine.
right. So I'm
It's
just trying to
painful.
help you brainstorm about, so
Chicken
what are
pox
some of the
before.
questions that you're gonna ask your doctor, okay? I have a couple other ones that maybe we didn't. Do I still have tests that haven't been completed yet? What do I do if I forget to take my insulin or my diabetes in the morning? What do I do, right?
Mhm.
That's one question. What should I do if I get the cold or the flu? Sometimes that impacts your blood sugar, all right? So these are some of the questions that you might consider writing down for your questions for your doctor. The last thing that we're gonna do today is we're gonna do a quick scenario, okay? So when we think about managing our diabetes, it's important to learn to communicate with your doctor. Remember, it's gonna take time and practice, so we're gonna practice right now, okay? That's what we're gonna do right now. Practice how the right approach might get you to the better answer. So here's a scenario that I thought we could do. We're gonna do role playing, all right? So it's on the back of your, oh, yep, Denise has it right there. It's the last page of your stapled packet. I thought we would do scenario number 1, the medication-related side effects, okay? So, the scenario's right in front of you. I'm gonna read it, and you guys are gonna tell me the tools you're gonna use of how you're gonna approach your doctor with that, all right? We're gonna role play it, okay? Maria is prescribed the medication glucophage, you may know it as metformin, for the treatment of her diabetes. Maria has found that glucophage is helping her manage her blood sugar level better, but she has been feeling increasingly tired and dizzy, having nausea and stomach pain since starting this medication. She notes these symptoms are getting worse, and at times she doesn't take her metformin because her stomach hurts too much. Her primary care provider has told her that she's doing very well controlling her diabetes with the glucophage, but she's worried about continuing on this medication. She wants to discuss this with her primary care provider who's been providing the glucophage, but she is concerned that he is going to refuse to make a change or will brush off her concerns. Okay, so maybe if one of you could, who would like to be the provider? And who wants to be Maria? Don't make me call on you.
I'll try to be the provider.
Okay, so Tom's gonna be the provider. Who's gonna be Maria? Sonia, thanks, I saw your hand. Okay, go for it. Okay, Sonia, you finally get to see your provider.
Well, doctor, I've been having concerns about the glucophage. I've been feeling dizzy, headaches, nausea, and I don't think I should be taking it anymore. I should have something else.
Have you been dizzy and headaches before the glucophage?
No,
Metformin?
no,
Only after, since you started taking it?
since I started taking
You changed your diet, exercise plan?
it. No.
Nothing at all?
No.
Well, I think we should stick with it for a couple more months just to see. It might be something you'll get over.
Well, I'll try it, but if it doesn't work, I will call you.
Good, thank you.
Okay, so that was extremely respectful. That was great. What do we think about that? Because we already know that Sonia is really upset about this, and sometimes she skips it, right?
Mm-hmm.
Okay, but Tom, you're looking at her numbers and she's looking really good, right? Right? So the
Yeah,
truth is that the glucophage, does it get better over time, is what you're saying, right?
Right, if, especially the nausea and distress gets better, just stay out for a while.
Or you.
I was trying to be the doctor she was afraid of talking to.
Yeah, and you did a great job. You were like, I'm not listening to any of this, right? Isn't that right? Tom did a good job. He shut you right down, right? Okay,
Yes.
now you're frustrated, so keep going. Well, what are you gonna do?
Well, I think you should give me something for the dizziness and symptoms I've been having with the metformin.
Okay, well, I'm really busy right now. Can you make another appointment for a week? We'll come back. Maybe you'll be feeling better by then.
No.
Wow, you guys are tough.
No, we're right here. We talk about it now.
All right, well, I'll give you something else if you insist.
Okay, thank you.
Okay, that was beautiful. That was great. And I think Tom did a great job because he sort of heard her concern, but he was looking at the numbers. He wasn't looking at Sonia, right, Tom?
Right.
You were looking at Sonia as a diabetic whose numbers looked really good. And you had more information. You know that she was going to get over it, right? You were like, I didn't tell him. You didn't tell him that you were skipping your medications, right?
No, I didn't.
No, you didn't tell him because you kind of wanted to avoid that, right? And so I appreciate, how many can appreciate that? Because Sonia didn't tell him. How many of us don't tell our providers everything? I can raise an amen to that,
Yeah.
right? Okay, so here's the thing, when our providers think that we're doing everything that they told us, oftentimes what they do is they just add more medications because they think Sonia's doing a really good job, and so maybe I need to put more medications on it. So you guys did let's give them a hand, they did a really good job, I think, okay? So, were you frustrated at the end of that, Sonia?
A little, yes.
Yeah, because my doctor would have told me stop taking it. That's what I get it at, because I understand everything he said. It was a great thing, her levels, what it was doing and making her better. But then I thought about the stomach pain, the nausea. sometimes you can overtake a medication and give you side effects. And
Well-
she could have been probably had side effects from it.
Well,
It's
anybody
probably
who,
time to stop taking it for now anyway.
so
I
metformin
don't
does often do that.
Yeah,
It
it
often does it. And so just, Tom was deliberately being belligerent. He was trying to be that doctor who's not gonna listen to the complaint of Sonia, because from his perspective, she was doing just great.
Okay.
And I love how you stood your ground, you were respectful, you made your concerns known. Your
Right,
concerns
she
were
did.
one thing, I don't feel well on this medication. I know my numbers look good, but I'm not feeling great. And there are some medications you can take differently, right?
Yeah, there is.
Okay, so for next week, does anybody have, let's just quickly summarize, what did we do today? What did we talk about today?
About
So-
the idea concept.
Idea,
Tools,
problem solving,
tools.
tools, which would be the idea and problem solving.
Mm-hmm.
What was the other, how to communicate?
Yes.
Medications
Medications, that's right, okay. So,
and diabetes.
and diabetes,
Yeah.
that's
Yes.
exactly right,
Mhm.
okay. So today we discussed the problem solving and learned that you can use the idea approach to working on dealing with many of the problems that come up with managing your diabetes. The idea approach takes a little time to get used to, and we're gonna be using it all through the next 6 sessions. And in fact, you can use that to solve a lot of the issues that we come up with in our daily life. Buy this car, buy that car, whatever you want. The idea approach really works. It can be truly helpful in many situations. It won't be the last time you hear about it. We also talked about how important it is that you talk to your primary care provider and you have a good relationship. I love what Sonia said initially, which was how sad she was that she was losing that relationship. It's like a trusted friend, right?
Oh, yes.
It's like a trusted friend. But the bottom line is, if you don't tell your primary care provider what's important for you, they won't be able to help you. They can't read your mind. As much as I think they would like to sometimes, they can't read your mind, okay? But the best choice for you is what works best for you. Remember, what we talked about in the beginning was, I can't manage 2 pills a day. I can manage 1 pill a day. So what's the best choice for me? I'm gonna ask my doctor for 1 pill a day, okay? So please do your home practice for next week, and please bring in the food labels, because we'll have fun looking at that next week as well. Thank you all for coming.
Okay.
Oh, you guys are so helpful. Just looking at you guys the whole time, I'm like, they're with me. Thank you guys, and thank you for being honest and answering the